This is Rosie the Rolfer. And tell us about yourself. Tell us your full name and where you practice.
Sure. I'm Rose, your Rolfer. My real name is Rosalind, Rosalind Smith. And I practice in Denver, Colorado Springs, Boulder, and Centennial, mostly Colorado Springs and Denver. I get to see Jerry today, and we looked at my feet and my calcaneus, my subtalar. We looked at how
some cuneiforms.
Some cuneiforms and the way my cuneiform was anterior. And we looked at the way that the bones in my tibia were not translating it felt like they could spring, and then they also didn't have any translation of force. In some places felt blank. It's the way it felt from the inside while he tested me gently. And so I remember those two adjustments were very gentle and brought back adaptability through the rotation in my lower leg, the ability for my heel to lengthen, and fluidity. Like working on my lower feet, when I got up and walked, the fluidity was all the way up in my pelvis from femurs down. And while it was going on, I also had just this experience of my peripheral vision and my cognitive visual processor space getting broader and being able to bring in more light and like rest into receiving information too. So whatever I was being distracted by in my lower limbs, it was taking my attention somewhere, really freed up. And then we did some for my jaw and something else. I think a great stretch for my pelvis.
Yeah, got your pelvis and your hips.
Yeah, just a yield experience where the ilium got to come back by just finding the direction it wanted to sink into and letting it be supported there. It was really nice. And something about the way extension wasn't happening for one of my legs also. So very neutralizing, yielding, deepening into joints, and also reminding of where transmission of weight seemed to bring it together. And then it took about 4 walks down the hall until I felt like, dang, I came online with it too. I was like, oh, it feels great. So yeah, really gentle experience for a lot of shift.
And so it's work with joints, but joints are interlinked with everything. The body's inextricably interlinked, right? So
Sure.
You can't say, I'm not treating your nervous system. You can't say, I'm just treating a ligament, or I'm just treating a muscle, or whatever.
You're treating me, my whole me. Yeah, I could tell that you're testing joints and that we're finding the change by measuring joints, but that the work is about relating the whole. Yeah.
Very good.
Yeah.
And you worked on me, and it was wonderful work. And I'm going to schedule a few more sessions with you. I got hit by a car as a pedestrian, and so I need, more than just my work, right?
Yeah, more length and space for all of us is really helpful.
Indeed. Any
Thanks.
final thoughts?
I just appreciate the way that you're able to test and I can track with you how I change, like follow your process. So it makes it easier to like know that I got something.
Nice.
Because I'm always experiencing lots of shift in my body, but I was able to see what it was really specifically from what you did.
Very good.
Yeah, thanks.
Well, thank you for the trade. I'm grateful.
Yeah.